Good afternoon, everybody. It is Amber Kivitz here with Lifepro. I am super excited to be sharing with you some different topics of interest today, just based off of a lot of messages that we've been seeing in our communities and what we're hearing from our consumers and how we're working with our clientele outside of Lifepro. I wanted to be able to share this special topic of interest with everybody. And it is simply how can you use Lifepro products as a strategy, whether it's going into surgery or coming out of surgery, no matter what kind of surgery it is. What do you need to know about going in and coming out on the other side, and what Lifepro products might you already have, or even similar products? If you don't have Lifepro products, but you have something similar, how can we make life more comfortable, easier, less painful for you from the convenience of your home? Obviously, if you're going to be working with a surgeon and having a surgery done, you're probably going to work with a physical therapist or their staff on the other side. But how you prepare going into a surgery also makes a difference as to how you come out on the other side. So I wanted to share with you some different things to keep into consideration, because I'm seeing in our community group, we have a lot of people who are commenting about how soon can I get on my vibration plate after I've had a total knee replacement, or I've had spine surgery. Is it safe for me to use the vibration plate? Or I have had a foot ankle fracture and I've got plates and screws. Is it okay to use red light therapy? So I wanted to share with you some of those, some of those questions, answers that are presented to me in a professional setting. I have been in the sports medicine business, human performance as well, and do a lot of massage body work, Eastern methodology type treatments since 2002, and was in my undergraduate experience in sports medicine for 6 years at one of the top programs in the nation. And so as soon as I got out of my athletic training adventures and got more into the therapeutic side of things, I started working for 86 different surgeons doing their post-operative care, doing their casting, their splinting, their hardware removal, teaching patients how to use different things from the convenience of home, exercises that they should be doing at home in order to continue to work with their recovery on a daily basis until they were seeing our therapists. And so in recovering from my own surgeries, I've had multiple abdominal surgeries. I've had a C-section, hysterectomy. I've had exploratory surgery. I've had a couple of different breast surgeries, reduction. I've been through a lot. And so being in the sports medicine business and understanding the body professionally, but also personally, I've been able to really learn a lot with Lifepro about how our products and the technology is very different and unique from products that your physical therapist or physicians, surgeons might not be aware of because of the clinical studies that are associated with those. And so in talking with a lot of our product consumers in our community on Facebook as well as on YouTube, and them contacting me personally and trying to understand, when is it okay to use this product? When is it okay to start using that product? Are there contraindications? And what I want to make sure and remind you of, I'm not taking away from any of the medical advice that your healthcare practitioner or doctor has already given you. I'm just complementing it with more information, not with the intention of trying to prove others wrong, but with the opportunity to stimulate conversation, or maybe you might look into it for your own needs or ask the right questions to your professionals that you're working with. And between Debbie and I are both very familiar from our past career experience in working with surgeons, doctors, other medical professionals throughout the whole spectrum. We have been working with those medical professionals for 20 plus years. Roseanne has been in the exercise business for multiple decades. So we are not new to understanding how the body works, especially when it's in a state of trauma or fight or flight. So I wanted to be able to share with you some of the do's and the don'ts. It doesn't matter what kind of surgery you've had, but do make sure, if you happen to be listening, whether you're on YouTube, whether you're Facebook, whether you've heard it from somewhere else, if you don't mind entering in questions in the comment section, if you want me to answer specific questions that might be triggering your interest, please don't hesitate to put in the chat comment box of questions or concerns, or maybe even some of your own successes that you might have shared over years when you've gone through some of your stuff. My niche, I'm an entrepreneur outside of what I do for Lifepro, and my niche is instant pain relief. People fly in to see me. I fly all over the country, and I work. Every single client usually is driven to me, attracted to me because they're in pain. And so my specialty is non-medicinal pain relief. So that means I'm not telling, I don't want you to have to take a pill in order for your pain to drop down. I like to do it very naturally. And Lifepro has provided me a firm foundation outside of what I already had established in being certified under 86 different surgeons of all different disciplines. I've seen a lot in my career, and I've seen a lot of different things in the last 5 years, especially with the pandemic, and people not being able to see their therapist or their doctors after having an elective surgery. I've been taking on a lot of those people head on because I was the only one that would take care of them at the time. So I have seen a lot of what nots to do from them finding me because they're in panic mode. And I've also been able to teach a lot of doctors how to kind of brush up or how to modernize some of their own post-surgical protocols through new technology that has become affordable and available to us from the convenience of home. Used to be a lot of this technology was really expensive, that you couldn't utilize it from the convenience of home unless you were part of the ultra wealthy. And now anybody and everybody can have access to medical level type responses on the other side. This is not commercial medical grade products that we're sharing with you, but the technology is. And it doesn't matter what level of infrared light you're using, what level of red light therapy you're using. Red light therapy is red light therapy, and infrared light is infrared light. So it works at a very specific frequency of a nanometer. And so depending on, and same thing with our vibration plates. If you're used to using commercial plates in a fitness center or at your local tanning salon, or you've worked with it with your chiropractor, vibration is vibration, right? And so you don't have to have commercial medical grade vibration in order to make a difference in your own recovery. You can do little microdoses. And I actually got involved with Lifepro several years ago, back in 2018, after having a total hysterectomy. And I had done everything. I had done the physical therapy. I had done the chiropractic care. I'd seen the surgeon and was still in a lot of pain and couldn't understand why until I started using a Lifepro vibration plate. The turbo was the first one that I had, and my pain was gone in 14 days just standing on it. And that's when I started learning a lot more about pain relief as well as vibration and how our body really works in the scarring process on the other side. So I am kind of one of those sought after professionals, one of the best in the world at scar tissue management, surgical going in, surgical post, rewiring the mind, because the first thing that happens when you go in for a surgery is your body goes into a state of fight or flight, super guardian mode. So that vagus nerve, which is our 10th cranial nerve, it exists up here in our head behind our ears. That nerve is responsible for being in fight or flight, go defense mode, or being in recovery repair mode. You can't be in both at the same time. And I didn't learn that until my own adversity kicked me out there, and I had tried everything to get better, and I was supposed to be better after having body parts removed, and I was worse. Couldn't figure that out. Now I'm completely pain-free today. 8 spinal injuries, learning to walk normal again after 8 spinal injuries without surgery. And then, multiple other traumas that I didn't understand, nor did any other professional understand or want to take the time for me to understand. So that's what I'm here for today, is just kind of to give you some insight on what you want to know going in, what questions you might want to be asking your medical staff. And remember, they work for you. You don't work for them. They work for you. You're choosing for them to take care of you. So you are in control. There are so many surgeons that do so many different things. If you don't like the answers you're getting from this knee doctor for a total knee replacement, get 2 or 3 other opinions. Even if you have to pay an office visit, it is worth making sure that this doctor doesn't give you that information. This doctor gives you something totally different. This one is somewhere in the middle. Then you get a 4th opinion, or ask people who have already been through it. But every personal experience is going to be different. So no matter what protocol that they're putting you on, no matter what your friends or your family has already been through, your body is going to go through this journey completely different, because our body reshapes, regenerates itself, and develops scar tissue based off our emotional energy and our thoughts. So I want to make sure that you're aware of that. So most important thing that I can tell you going into any kind of a surgery is make sure that you are ultra confident, unless it is emergency life-saving surgery. If you are ultra confident about going in for that total knee or total hip replacement or that foot ankle surgery, you have a torn labrum in your shoulder and you're wanting to, feel relief, you've got to go in 100% confident in that surgery, knowing that you're with the right team, knowing that you're doing the right thing, and knowing that you are going to be better on the other side, or it will be a bad experience altogether. How you go in mentally is how you're going to come out on the other side, and your body is going to hold on to that fear and that trauma, and it will not heal. So I see it every day in my practice. When we are cutting into the body, we are seeing a lot of different things, but that tissue there in the middle box, so this is right here, that's what it looks like on the inside, but it cannot be separated. There are multiple layers. And so when they cut through, they're cutting through a lot of times nerves and electrical highways, lots of cells and lots of connective tissue and fascia and other things that they don't even know that they're cutting through a lot of times. When everything comes back together through sutures or staples or whatever kind of mode that they seal you up with, our body goes into a scarring process. And so our scarring process starts when everything is normal. And then when the tissue gets violated or is intentionally cut through, it comes back into a big blob, big blob. And this is showing muscle injury, but all of our tissues do this. It comes back in a big blob. If you don't manage that blob pretty quick, it will take over the area and will continue to latch and attach. And so what we don't want is a lot of that, which is that webbing. That webbing is scar tissue adhesions. And that tissue actually holds on to our emotions. So if we're afraid we're not going to get better, guess what? We're not going to get better. If we go into surgery knowing that's the right thing to do, I'm going to feel so much better on the other side. I know it's going to be a lot of work. I know I'm going to have to take some time off. I know I'm going to have to slow down. You're going to come out better on the other side. Your body will change its frequency because our thoughts happen on a frequency. And your thoughts will change the frequency in which the cells are picking up information. The electrical signals that the brain sends through our nervous system and through our meridians and through the fascia sensory network is going to change based off of what we're thinking. So make sure when you're going in that you are really going in confident, because a scar is not what it seems, okay? It's not as it seems. There's a lot of emotion. Vectors are pulling from different sides. There's trauma. You know, a lot of individuals that I see, they lose their identity. Like for me, I had a hysterectomy. I no longer can be a mother ever again. I've got one child, one daughter, and I wanted more, but I couldn't have more. My body said, no, you're done. So the beautiful thing is I'm pain-free. I don't have that pain associated with hormones and with my uterus not wanting to function. But the trade-off of that is I gave up the opportunity for having my own biological children myself. So there's a loss of identity. Like, I don't know what I'm going to do. Am I going to be able to ride a bike? Am I going to be able to run with my child? Am I going to be able to be intimate again? Am I going to be able to do my job without being tired? Am I going to be able to walk normal and not feel pain? All of these questions are going through in our mind over and over and over again. And I came across a statistic, not only a statistic, but came across like some data just the other day. Let me see if I can pull it up here really quick. It talks about how long a positive thought stays in our mind. Somebody can give us a compliment. I'm not seeing it right up. Somebody can give us a compliment and we hear it and then it's gone, like within a few hours. But if somebody tells you something bad, if somebody tells you that you are not a good person, or they tell you that you shouldn't smile anymore because your forehead is wrinkling when you smile because you're smiling so big that you're wrinkling, that those muscles are like, you need to get the Botox done, right? Or if when you are laughing, that you look really funny when you're laughing and somebody tells you that, you're not going to laugh anymore because you're afraid of what others are going to think about you. And you remember that for years. I was bullied as a kid. I still remember the names and where I was at and what they did to me that bullied me. And I'm 47 and I will never forget it. But I have gotten a lot of compliments paid to me over the last 40 years. I have compliments, emailed, text messages, in conversation, and I still remember the bad more often than I remember the compliments that come flooding in at times. You really have to rewire your thinking process and remember to talk to yourself in surgery, after surgery. You have to talk to yourself as if you are talking to your own child in a positive direction or to one of your closest friends and trying to make them feel better. You have to talk to yourself like that. Not think it, but you actually have to talk out loud, because if you have stinking thinking, we think 60,000 to 70,000 thoughts per day, and over 40,000 of those for most people are negative. That's what you become. That's the frequency that your body operates on. That's why vibration is so powerful, because it operates on different frequencies, and the intensity that we are able to introduce vibration into our body, it changes the frequency of our thinking. It releases different hormones. It shuts down the bad hormones, and it breaks up that nasty old web of tissue. So vibration is one of my favorite things to recommend for pain management going into surgery, but also coming out on the other side. But how we think actually changes everything going in and coming out on the other side. So most important thing I want to make sure and share with you today, the number one top takeaway is, if you're having a bad time in your life, you've been just given the diagnosis that you've got cancer and you've got to have this done, and they're going to remove all this stuff at the same time. You've got to remember you've already survived your worst day, and you've got to remember that you can believe in the specialists who do this all day, every day. If you don't feel trustworthy of those people, find yourself a new team, because they work for you. You are paying them to help you. You don't have to see anybody. Insurance can tell you that you have to, but you have the choice. Make sure that you trust your team. Make sure that you trust us if that's what you're listening to. That's why I love sharing with all of you and being able to take this opportunity to making a difference, because I do this stuff. You know, they say it takes 10,000 hours to master something. I'm like 30,000 hours in at this point in my life. So I love to be able to share what I'm seeing every day that doesn't go into a clinical study. It is truly emotional connection with everybody. So thinking positively is priority number one, okay? When it comes to releasing pain, reducing pain, and healing efficiently. Because if you're not thinking strong, you're not thinking positive, you're not thinking confident, it will block your body from being able to repair itself. It will stimulate more stress hormones. Cortisol will go through the roof, which shuts down the healing hormones that actually help you get better. It puts your body into a state of fight or flight to become more guarded, more tense. And when your body can't relax, and when you can't receive and you can't rest, it can't heal, which means you're going to come up in a not so good way on the other side with more scar tissue than what the doctors are anticipating. And it's different. Scar tissue is totally different on every human being. I have seen, I can't tell you how many people I have seen in my career: knee replacements, hip replacements, spinal surgery, complete trauma surgery where they've had to do external bone fixators, Swiss cheese bone, brain surgery. I've seen so much stuff, and everybody heals different. The scar tissue always comes back different because it is emotionally driven, frequency driven. So I want to make sure, number one, focusing on the good thinking, because you can heal without any of this stuff by just how you present your thoughts. So positive energy. And if you don't have the energy to think positive because you are just exhausted, overwhelmed, that is normal too. Then you got to reach out and say, hey, I'm in a bad place. I don't feel good. I don't like myself. I don't like my recovery. And let one of us pick you up and carry you, because you become who you surround yourself with. And if you surround yourself with a lot of Ambers and a lot of Debbies and a lot of Joels and other people within Lifepro Roseanne's and people who are really positive and cheerleading for you and lifting you up, because you can't lift yourself up, you will recover better. But you have to make sure that those people around you are aware, because they don't read minds. And most people are ashamed to talk about it. Don't be ashamed to talk about it. It's totally normal to come out on the other side of surgery in a depression and to get stuck there. And it's really easy to go into it that way as well. So that's number one. When it comes to all this technology, I've got a lot of different gadgets out here today. Again, I do a lot of post-operative care. I do a lot of pain management, instant pain relief. Vibration is my go-to. It is my number one go-to. I have created a diagnostic approach using the Lifepro plates, the vibration plates. The Rumble X Plus is my favorite. I've got it behind me here, as well as the little Waver Mini, because you can just pick it up and take it anywhere you want to go. When you are not using certain muscles, so the first thing that happens if you've got an orthopedic injury, if you have a musculoskeletal injury, you've got knee pain, you've got arthritis, you've got joint issues, the first thing that is going to happen after a pain signal that is going to require you to see a physician or a surgeon for surgery is you're going to have muscle shutdown. Your brain is electrically going to send signals to that area, shutting communication highways off so that you can't use it, so that you don't hurt yourself further. What is not communicated by most professionals when you're working with a PT, a physical therapist, or a medical practitioner for your rehab, going into or coming out, most of them are not going to share with you that your brain shuts down the path of most important information highway whenever you're injured, and it's going to reroute all this information through the path of least resistance, even though it's not the most effective or efficient. So, and once it shuts down that main interstate, it doesn't turn it back on right away on its own. So what makes vibration really powerful, whether it's a vibration plate, whether it's a massage gun, whether it's one of our vibrating red light therapy devices, the first thing that happens with vibration is it excites our body to reignite information, but also muscle contraction. As soon as you become injured or you have to have a surgery, your muscles are going to shrink by at least 50% in the first 14 days. That is what the evidence has shown for the last 30, 40 years. You're going to lose half of your strength in less than 2 weeks, which means you're going to be very unstable and a little wonky, okay? So we got to make sure that we are turning some of those muscles back on to protect you. And it doesn't mean that you got to go to the gym and do a bunch of strength training. You just have to trigger an excitatory process in which the body will start firing those muscles again. And in doing that, you've got to remember too, our lymphatic system, as soon as an injury happens, it starts pushing fluid into the space of injury or violation. And you start maintaining a lot of fluid. And the more fluid that you have in an injured area, the more pressure, because there's not as much space. So we have to figure out a way to get that fluid out of there as quickly as possible after the first 48 hours following an injury or a setback, because the longer that fluid stays in that space, the more toxic it becomes, the more stagnant it gets, which means new stuff can't flow in to help you. So vibration is really important for that. And if you don't feel safe using vibration at home, then come see somebody like me or go see your local massage therapist and have them do some lymphatic movements, lymphatic massage, in order to help mobilize that stuff out of there. You can also use compression garments, compression sleeves. Our Axis air compression pneumatic boots work really good. They're like leg boots that look like moonwalking boots, and they come all the way up to your hips. If you have a lower extremity injury, that will help in milking that fluid out of the space so that you can get new stuff in there, which is what heals and helps and actually reduces the pressure, which causes the pain sensors to go bananas. So when it comes to immediately following, we have fluid that's going to make its way into that space, which is really important for part of the recovery. So we don't want to completely avoid that. We need the body to do what it initially needs to do. We need to limit and control how much for how long. So as soon as you're able to remove that out of the space or mobilize it back into your lymph nodes, your lymphatic system then recirculates it and eliminates it through its garbage disposal process. So that's why drinking fluids is really important. Not alcoholic beverages, not soda, not carbonation, not juices, not high calorie crap. You've got to make sure that you are putting clear fluids, non-alcoholic related, into your system. If you are going into surgery or coming out on the other side of surgery and you're drinking any kind of alcohol, you are delaying your recovery by a lot, because every alcoholic beverage that goes into your system converts through the liver into a neurotoxin, in some ways more like a formaldehyde, and absolutely destroys your cells for days on end. And so that's for each drink. So don't do that post-surgery, and don't do that going into surgery to see if you can get yourself into a different state of mind, because it's not good on the other side. It actually blocks healing and causes more problems. So that's really important. Water and electrolytes, clear fluids are really important. Some people will do bone broth. That's all really, really good stuff. But you've got to push fluids, because the more fluid in, the more it's going to flush out the fluid, which means you're recirculating new stuff, which means things can heal and you're getting new nutrients. Stagnant flow is what causes more pain, more problems, more mutation, more scar tissue, less healing, less happy. So stagnant flow, not good. That's where vibration plates come into handy. You might not be able to walk or be able to use your body that you've had surgically worked on, but you can use vibration in the form of a massage gun or through vibration plates in order to cause some of those muscles to twitch, which reactivates them, which works like a pump to mobilizing that fluid, which then also allows for your body to recirculate and get new nutrients down there. So it's really important to utilize vibration. Now let's talk about that. We have some new devices. This one is, I know we're coming off of Amazon Prime days. This one is already sold out, and this one just arrived. We just released this one out on the market just this last month, and it is really cool technology. It's new stuff that we're seeing in the wellness space. This is a lymphatic massage gun. So its sole intention, its sole purpose is to mobilize and stimulate the circulation of lymph and fluid in general. And if you are one of those individuals who has, you've got what some will call cellulite, or you've got joint pain, you can use this. Most important thing to remember when you are working with yourself or somebody who has had surgery is you want to make sure not to go directly in the area. If you're within 6 weeks of surgery, so you've had surgery in the 6 weeks of the past, you don't want to use any of this stuff directly on the spot. Unless you've cleared it with your doctor. If you've had your sutures or your staples removed and your doctor has given you permission to walk and start working on range of motion, you can use this stuff. So that's the criteria. You've had your sutures or your staples removed. The wound is completely sealed and is showing that it's healing, and you are ordered that you can now start riding a bike or walking with a walker or walking on a treadmill, and your therapist is working with you to move. Then you can use massage gun vibration for helping. If you can't tolerate direct contact in or around the area that you've had your care, then you're going to go further up and further away so that you can work with the areas surrounding that. Okay. This new massage gun, this is the Spinergy. Okay. This new massage gun comes with all these different types of tips that have texture to them. And the goal is it actually works not vibration alone, but vibration with spinning. And the goal is to break up sticky tissue, like I showed you earlier in that picture. And so when we turn this on, it is whisper quiet, so you can't hear it. But that is our new Spinergy lymphatic massage gun. And it's digital on top. So when we touch it, we push that power button and it goes up to multiple speeds. So cool. But watch here. So this is my arm, and you can see it almost looks like it's floating. Okay. It's breaking things up in a vibrating circular spinning kind of way, okay? And we're going to push and hold in order to turn it off, because this one doesn't have much of a surface that can grip and adjust, but we're going to pull this off, and then we're going to put the one with the prongs on there, or the more of a texture. What makes this really cool too, it comes with lavender essential oil, which is really good for your skin and for scars, really good for scars. Lavender is a really good skin oil. You can use the Spinergy with massage oils. So you can actually put the massage oils on this tip, and it will actually drive it into your tissue. Way cool how it works, right? It's the first of its kind for Lifepro. So you got to see not much movement happening here. So then when I take this and add, now you can see like it's gripping and it's vibrating and it's leaving. I'll get this up close and in person. Whew, it's definitely vibrating. So you're going to see it's gripping, and you can see how the texture of my tissue changes as it's doing its work. So you can actually, I'm not pushing hard and dragging. We don't want to do that. We want it to float. Okay. A little bit of floating, a little bit of compression. Okay. But it is moving things beneath the surface. So if this is your knee, okay, if we've got a total knee replacement, we're going to go above in a very slow pattern. 1 minute per second is what I teach. 1 inch per second. I said 1 minute per second. That makes no sense. 1 inch per second. So we're moving very, very slow. So we're going to avoid the scar, and we're going to go down here in the lower leg. Okay. Lower leg, and then above. So anyways, when you are working with joint replacements, even if you've had shoulder surgery, when you have shoulder surgery, this gets tight, low back gets tight, arm is stiff, can't move. So what do? Now we turn it into across here, across the chest, because you didn't have your chest operated on. You had the shoulder, the socket, most often the joint itself. But the first thing that goes into lockdown mode when you have a shoulder surgery is your pec muscle. So you got to loosen that up, because those muscles attach into here, and next thing you know, you got neck pain, right? So vibration will do that. If you're in a sling from a shoulder surgery and the doctor says, really don't want you to use anything that's going to stir this up, then you do the other shoulder, because guess what? The other shoulder is working a lot harder, since you only have one now, and the other one is in shutdown mode. So you're going to use it on the other shoulder, and you're going to use it on your back. You got to keep stuff moving. So even if the doctors are telling you, hey, don't be moving, I don't want you to move out of the sling yet, I don't want you to work on flexion and extension, I don't want you to rotate, that's okay. We still have to get stuff moving, because the longer that stuff stays there, the more sticky it gets and the more scar tissue that sets in. So fluid movement is really important. The new Spinergy Massage Gun by Lifepro will do that. Now, again, that is sold out today at the moment. Doesn't mean it's going to be sold out when you go on there to check next time. But again, we just had our Prime Days, so there's a lot of these awesome little gadgets that are being restocked. So don't give up if you don't have it. Give it some time. This is one of our original massage guns. This is one of my favorites. It's been around for very long. It's been around since 2019, I believe. It's the Sonic LX. You can get this right now on Amazon. And this tip right here looks like a little springy tip, okay? When you're recovering from surgery, you want to avoid using metal, okay? Because metal doesn't absorb and it doesn't transfer energy. And you got to be really careful with going with hard molded plastic. We want to make sure that we're doing something that is soft, something that feels good, and transfers energy from one to another. So on this one, I'm going to use this, it looks like a little springy tip, and it's squishy, okay? This one, we turn it on from the bottom, and multiple levels of intensity. But again, this is very different from the one I just showed you from the Spinergy, in that I'm just letting this vibrate and I'm letting it float. So if you've had carpal tunnel syndrome surgery, carpal tunnel release, yes, you're going to have a scar through here, and they just release pressure. So we want to make sure that we're taking care of these muscles up here because those tendons attach down here. Or we want to take care of the shoulder because you're in a splint for 2 weeks. But you can still work the elbow, even though it's not going to hurt anything in the palm. And if not that, just vibration feels good. So if you had this arm operated on, then do it on your leg because you don't have to do it on the body part that you had operated on. But vibration anywhere feels really, really good, soothing, and it takes your mind off of what hurts and transfers the pain to pleasure. And so if you can use the massage gun to create vibration someplace else, then your brain will pick up the signal of pleasure, and then you don't feel the pain as much, so that you can attempt to do other movements. So it doesn't matter where you use your massage gun, your body just needs the vibration to stimulate a shift in the thinking process, but also what your body feels. It wants to feel good. And most people, if you've had surgery, you don't want anybody else touching you because you're guarded. So you can always treat yourself. But Sonic LX, I have used this for several years. I got this in 2019, and I've been using it ever since. It is my favorite of all of our massage guns, and I've got every single one of our massage guns we've ever had. This is my favorite. So considerations, again, if you have had a total knee replacement, you don't want to necessarily have to go into the knee. You're going to go into the hip, because when you have a total knee replacement, it changes your spinal alignment. It changes your hip alignment. And so these muscles are going to get really tight. So if you can soften this up and soften this up, then the knee doesn't hurt as much because it is a hinge joint. So it's connecting foot to hip in the middle, and it's not meant to do this, and it's not meant to do this. It's not meant to teeter-totter. It's meant to connect. It's like the dot in the middle that connects the two big joints. So if you can keep your hips loose and you can keep your feet going, the knee pain will be significantly less, and you have less fluid, so you're able to mobilize that. Vibration. Now, there's a lot of people who've asked me about metal plates. If you've got metal plates, if you've got prosthetics, if you've got pacemakers, you're going to be fine with all of that using vibration from a seated position or from a modified standing position. Okay, you're going to be fine. These machines do not have enough intensity to dismantle hardware that has been surgically fixated in your body. Okay, so I don't want that to be a fear. If anything, it's going to help with reactivating certain muscles to fire. These machines have the power to stimulate up to 90%. I'm going to say 80 to 90% is like that magic range. It's going to stimulate that percentage of muscle fibers to twitch like crazy, anywhere from 10 to 50 times a second, which is muscle activation, which works like a pump and tickles and moves stuff. If you can get those muscles refiring without the brain providing the signal, you're way ahead of the curve. Because most individuals, that electrical signal becomes disconnected and you shut it off. So those muscles don't want to fire at all. So vibration will cause them to start refiring. So I'm going to demonstrate that. And if you have questions, again, make sure and reach out. It doesn't matter which vibration plate you have. You just want to make sure you have something. So I have the Rumble X Plus next to me here, and I have the Waver Mini over here. And I got lots of props. If you have had a lower body injury and or surgery, so from the spine down, you've got to get your feet reconnected, because 80% of the nerve cells that are what we call mechanoreceptors that provide information to our brain about where we're at in space and how we move are on the skin on the bottom of our feet. So if you're disconnecting your feet and you're not exciting your feet, the brain is not getting excitatory information either, which means your body heals a lot slower. So even if your feet are not operated on, or your leg is not operated on, if it's your shoulder, get your feet involved, because everything goes through the feet or whatever is in contact with the ground. So my number one goal with working with people after lower body surgery is getting their feet turned on. And we can do that just by making contact with the vibration plate in a seated position, in a safe position. So if you've had knee surgery or hip surgery, you can still sit down and put your feet on, and it will excite those little cells. You can do that through oscillation or pulsation. Lateral shift works as well, or a combination of all three, but tickling is the secret. If you're trying to wake somebody up, if you tickle them, or if you're trying to check on a baby, if a baby is asleep or breathing, you tickle the bottom of their foot in order to see if they're like alert. We have to do the same thing after surgery. Ignite that foot, okay? So if you're experiencing neuropathy in your feet, which happens very commonly with breast cancer surgery and radiation, or peripheral neuropathy because of trauma, if your feet are ultra sensitive, but we still need to get that vibration, get yourself a pool noodle. This is just a pool noodle from a dollar store. And you just put your arches on the pool noodle on the vibration, and it will transfer through to your body without full intensity. But make sure you're doing it barefoot, because you can modify. You can put a towel over the top of it. These are bigger domes that you can put down, and I'm going to bring the camera down here so you can see it at a lower level and you can see how this is working. But this is what I do on all my clients who have had a lower body injury. I get their feet ignited immediately, because that is the only way that we're going to get energy to everything else. All right, so rearranging the space here so that you can see really, really well. And if you're listening in, tell me what excites you about listening to this stuff today. If there's anything that sticks out. Now, what I want to make sure of today, when we're on a vibration plate, no matter which one it is, okay, we have to make sure that our hips are sitting higher than our knees, okay? So in other words, when you look at your angle from the side, you want your booty to be higher than the level of your knee. If your knee is higher than your booty, that's bad. You don't want that, because you're going to end up with more problems. So make sure that you're sitting high enough that your booty is sitting higher than your knee. There we go. All right. I don't care which program you choose. I always like to choose the P2. It's an exciting preset program for me. I have a lot of people who tell me that they just turn on all the motors and crank up the energy. The body has to have change. When we do the same thing for 10 minutes, same frequency, same motor activation, the body gets really bored. It loves having a little bit of a party. So we got to create it and give it the party. So you're going to do that by choosing one of your preset programs, unless you want to mix it up. And you can do like a P1, a P4, and a P8 all on the same day. Just mix it up. And I say that because the Waver and the Waver Mini have got multiple programs. The Rumble X series only has 3 for most of those products. So we just got to get our feet on, and we got to go for a ride. Now, there are 3 really prominent points on the bottom of your foot that are really important, okay? So I'm going to come down here and show you all this. Part of that fun part of my day. Base of your big toe right here is called point A. Base of your little toe right here, B. Center of your heel is C. If you put pressure on all 3 of those points, it makes a triangle. And so we want to have those 3 points on our vibration plate as equally feeling as possible, so that we can maximize how much energy is entering in through the bottom of our feet. Again, it is a super excited input bank. So if we can put more money in the bank, then we can invest more into time and then come out better on the other side. The vibration plate is giving you that extra energy and is stimulating that so you can heal. Now, if you are 2 weeks post-op on your total knee replacement, you are not going to rearrange anything in these joints by just having your feet on the vibration plate. It does not generate enough power to do that. Now, can you cause more problems by doing crazy exercises in addition to this? If you're not careful, you just gotta let your body feel and let it talk to you, because your body will tell you exactly what it needs. In this position, I'm making sure that my knees are sitting somewhere over the top of my foot. If I'm sitting back here, I'm not going to be able to load the same way and receive the same amount of energy. So if I'm sitting, making sure that my knees are directly over the arch of my foot, over the top of my foot, I'm going to feel this energy all the way up into my hips, which is keeping those deep core muscles excited. And those deep core muscles is what really matters. Yes, the knee might have been fixed, or the hip might have been fixed, or the spine might have been fixed. But if this isn't working, then nothing up here works and nothing down there works. So we have to make sure that this stays working. Okay, if your feet are sensitive, you get that pool noodle and you just elevate your feet on the pool noodle. Everything's still receiving vibration. It just is not as sensitive as if I'm actually in contact with the plate. So whatever works for you is fine. If you don't want that much of a lift, you can take that pool noodle and cut it in half into a semicircle, and then you put it down instead. And you just enjoy what you feel. If you can't maintain 3 points of contact with the bottom of your foot, that's okay. But if you can optimize it, that's going to allow you to heal faster. It actually causes you to heal faster. The research proves that. But the more in contact you are direct with vibration, the better. Most people have very ticklish feet. This does not tickle the bottom of the feet because you're in control over it. If somebody's doing it to you, it's easier to tickle your feet, okay? So this is what it looks like on the Rublex Plus. And let's see what it looks like on the baby. This is the Waver Mini. We've got some new plates coming out very soon that are what they call nanos. They're just really, really little. So if you're really wanting to take it along to work, put your feet on them at work and elevate while you're at work. We have some much smaller plates coming out very soon. So Waver Mini is what I'm on right now. Waver Mini, and right now I just chose the P5 program. No rhyme or reason, just convenience. And so same thing. The difference is this one is only oscillating. There's no pulsation. There's no lateral. It is just one motor teeter-tottering back and forth. It changes the speed at which it does that, but it's not changing the direction of the pattern. And just sitting on here like this is enough. You got to get the fluid in your legs moving, which is happening by this perfect storm, this earthquake effect. And the calf muscle down here is referred to as the second heart of the human body because it works like a pump to move fluid that's trapped back up to your lymphatic, your lymph nodes up top. So again, just make sure, like we don't want to sit here with our feet barely in contact with. Make sure you're maximizing how much contact your feet are in with the vibration plate. Speed just went up, so you're going to feel more jiggle, jiggle, jiggle. And the more jiggle you feel, and the longer you are experiencing it, the more likely you're going to get an itching sensation, or you might start to feel almost like bugs all over you. That's great. That means it's releasing toxins into your system out of that stuck tissue. Your body and brain are recognizing it as an invader, and it's finding a way to get rid of it. You will not itch for long periods of time after you start feeling the itching. When you get off the plate, the itching will dissipate very quickly within minutes, and you'll feel very different. Because we are shaking things up a bit without rattling the joint and the hardware loose, because we're shaking stuff up and we're turning on new muscles, you're probably not going to feel as good tomorrow because we don't like change. Our body doesn't like change, so it's going to be very resistant to change, even though we've already gone through the surgery. So we want to make sure that we're aware that just because we're a little sore tomorrow in different ways, we didn't cause any harm. We are getting new things moving, which causes what we call the delayed onset of muscle soreness. So it might happen tomorrow or the following day. Okay, now if you feel safe from a sitting standpoint and your doctor gives you the opportunity to walk, if you have been cleared to walk, you have every opportunity to stand. You don't have to do any squats. You don't have to do any lunges. Just standing on here makes a big difference. So I'm going to slide my box out of the way. We're going to go up a little higher so you can see from a distance so I don't max out the screen. And here we go. So there's a lot more jiggling happening. Not as much feeling down here in the lower legs, but man, I'm gonna feel it more up in here. The secret to making sure we don't feel it in our neck or feeling it between our ears is keeping our knees unlocked. So if you are locking your knees out completely, you gotta be really careful with that because we've got joint surfaces that are not supposed to be completely locked out, and it tends to go right through the back. It's not gonna hurt you, but it doesn't feel good over time. So make sure and keep your knees not locked out, but just barely relaxed, and just enjoy the ride. You don't have to do any exercises. If you have had a total knee replacement or a total hip replacement, or you've had any kind of pelvic surgery, if you can get yourself the infamous Amber squishy ball, you can get these on Amazon for $10, and just put it in between your legs, okay? You don't have to squeeze and try and pop it. Just putting that object in between your legs creates an energy circuit of vibration continuing to flow, and it's going to flow up through your pelvis, up through your core, and out through your shoulders, wherever you transfer, the energy. The energy is free flowing, it's not lost. So having the ball in between your knees is also stabilizing your sacroiliac joints, your SI joints, because when we stabilize here to the inside, the SI joints open up. And that is where a lot of pain comes from when we are in bed or we're stuck in a recliner because we have to sleep in a recliner for several weeks with a shoulder recovery. Just squeezing the ball is going to change how your back feels by just standing. So vibration is really good, and doesn't matter which level, which plate, just get on and go for the ride. All right? Okay. So that's what I wanted to share with you on that. I have got lots of red light therapy here. Red light therapy is awesome for tissue health. So, and I've covered that in other episodes of the past, but I've got my red light therapy, my bio remedy, or not my bio remedy. This is, gosh, I'm having a total brain fart at the moment. Yes, this is the BioHeal. So this has been around for quite a while. And when we go to turn it on, it's got a big switch on the back. We've also got one of these panels that's twice as long. And so when we turn it on, you're seeing right now near infrared and red light together. So these are both types of technology. You looking at it through the screen is not dangerous, but if this were sitting in front of you, you want to have sunglasses on or protective glasses on so that you're not looking directly into these powerful bulbs. We also have other, especially if you've had a knee replacement or knee surgery, or you've got arthritis and you're trying to avoid knee surgery. Yeah, that's really bright. There we go. Trying to make it so it's not blinding to all of you. We do have much smaller red light therapy devices. And these are not as powerful by a long shot as what this one is. So this one, you can actually look directly at this one and it's not going to cause issues with your eyes. Not telling you to do that, by the way, but if you do, it's not going to be a big problem for most, I would say. But this is, we make this Micro, Mini, and the Pro Elite. And these are nice because they are cordless. They have an external battery pack. Let's see if it's charged. It is, yay. Okay, so it magnetizes here to the outside. And when you magnetize it after you power it on, now we have these. These are not as big and loud as these bigger bulbs, different types of bulbs. So these, you're gonna be fine putting this on your shoulder and not having to worry about eye protection. This is way more concentrated. So you're not gonna put this on you. You're gonna put it on something so that it radiates to you. And if you're wanting to do this for your shoulder, you're gonna want to take your shirt off and actually expose your shoulder because you want direct skin exposure to whatever you're using for red light therapy or infrared light therapy, okay? Want to make sure that we are exposing direct skin. So if it's your back, You can get into one of our saunas and get the whole body. We make these for the back that are much, much bigger that wrap around. Just make sure you're making it direct skin contact for optimal results. But red light therapy, infrared light therapy combo, that's what these are. These are combo treatments. So you're getting both infrared and near infrared, which is referred to as phototherapy. Phototherapy, there's a lot of evidence, a lot of clinical studies, and I've done an episode on this many, many times in the past. You can go back on YouTube and type in Lifepro Amber red light therapy, and it will tell you, I actually have the clinical studies in front of me that I share with all of you. But if you're interested in some of that information, red light therapy and infrared light therapy are very similar. The difference is the depth at which they penetrate. Red light therapy is more superficial. Infrared light therapy is deeper. So if you have a combo treatment, you're getting superficial and depth in healing. But what makes it really nice, let me power this off. There we go. What makes it really nice is you can do it a couple of times a day. It regenerates stem cells. It regenerates collagen production. It reduces inflammation on the space. If you have a wound that does not want to heal, an open wound that doesn't want to heal, and you're not on antibiotics that are photosensitive, red light therapy will actually help heal an open wound faster. So if you have a scar that is just a few weeks old and you want to put red light therapy directly in contact with your scar, it will actually heal it faster than if you did nothing at all. So we have smaller gadgets. So our micro, we have a lot of red light therapy combo options. You'll see behind me the Aliva body. It is an entire mat. It's almost like a sleeping bag of red light therapy. So if you're wanting to get your whole body involved, you can. You just get yourself the blanket and go tuck in. We also have a mat. So if you don't want double-sided, you can slide in and just experience one side or lay on one side. On this side, I've got the pulsed electromagnetic fields, PMF. We've got two of those mats, two different sizes. Pulsed electromagnetic field is referred to a lot of times as the fifth element of the human body. And it's really hard to get that energia, naturally speaking, but PMF mats or grounding mats will do that. So if you don't already have a PMF mat, all you got to do is get one, lay on it. Most of all of our PMF mats also have infrared light associated with them. So you're getting double treatment with the same amount of time. But most important thing, like I said, as I started the episode, mindset is number one priority when coming out on the other side of a surgery and going into a surgery. The more positive and confident you are and more trusting you are of your team, the better you're going to come out on the other side. When you come out on the other side, vibration is going to be really important for re-stimulating not only muscle development, but it also regenerates bone tissue. So, if you're, a week and a half, 2 weeks post surgery on anything involving a bone, depending on what your surgeon is sharing with you, especially on a spine surgery, the vibration, not directly over the incision, but in other areas of the body, will help to mobilize fluid, which decreases pressure in the space, which takes pressure off the pain sensors, which reduces pain, which then allows you to be more functional. So it is like a big cycle in a sense, but there are lots of different methods that you can do that. So vibration through vibration plate or through massage gun are ideal. And then once you're able to get moving and you're already doing scar work and you have already started your strengthening process with your rehab specialist, then you can go with the rebounding, because the rebounding, the trampolines actually stimulate the fascia and the collagen to go from being all tattered and tangled into more springy and consistent in its texture, but also the ability for it to expand and transfer energy. So those are the big things. What I want to be really firm in sharing with you up front, there's a lot of changes that have come out in the sports medicine community as it relates to ice. Cryotherapy, or putting ice on a joint or in a musculoskeletal recovery, actually can cause more problems. So make sure you're listening to your doctor and whatever their methodology is, because in the first 48 hours, they might have you put a little bit of ice on occasionally just to prevent too much swelling in the space. But using ice long-term can cause tissue damage. It can cause tissue or cellular death, and it can cause more problems overall in a concentrated area. Polar plunging or cryo immersion, using the NordPod Plus or getting into cold water through the whole system will help to reset your inflammatory levels and stimulate the parasympathetic nervous system. It shocks the whole system. You have to be really careful how often you do that post-surgery, initially speaking, because again, you can interrupt tissue health and recovery, and you can cause more problems than you're helping. So make sure if you're wanting to use cryo that you are cold. If you're wanting to use ice, check with your doctor first, because I've seen a lot of surgeries going back for second and third revisions because of ice. I had some breast tissue surgery done a year ago, and doctor told me to use ice packs, which I did, and it actually killed my skin. I actually had tissue ischemia, in which I had to do wound care and debride my skin and the tissues underneath, and I had open wounds all over because I had a reaction to cold. And we're not talking ice packs. We're talking little gel packs. I had an allergic reaction, and the autoimmune response in my body attacked myself. And I've never, ever had that happen in the history of my life until that moment. So it led to more visits, extended the recovery process, had to really do more tissue wound recovery, which I'm certified in, so it's okay. I mean, I was ready for that. But for those of you who aren't, it makes for a lot more money. It makes for a longer recovery time and not as much fun for you. So be careful with using ice going to the other side of surgery. Going into surgery, ice can be very soothing for, controlling pain initially. On the other side, be careful of it. But the acronym used to be RICE: rest, ice, compression, elevation. It is no longer used by those that are at the world-class level and the very top of their game. Now it is MEAT, M-E-A-T, movement, exercise, therapeutic exercise, corrective exercise, analgesics, which is pain relief, and T is treatment. So we want to make sure that we're moving, because movement is medicine, motion is lotion. And the more that you're able to move, even if you are immobilized, the other parts of your body that you're able to move, and keep flowing, allows for the viscosity of your fluid to remain in motion as well. Do you want to go out and run and do a bunch of hill climbing? No, but you got to stay in the flow, if you get what I'm saying. So movement, corrective exercise. So that is range of motion, strength, getting those muscles to refire, working on mobility. Those are all exercises that your rehab specialist is going to work with you directly on. And then analgesic, which is pain relief, whatever mode, that's what we just talked about. These are all analgesic options, helping to reduce pain by causing the body to enhance its recovery as well as how it fixes itself. We are providing the optimal environment. We're not fixing you. We're providing you the optimal environment for your body to fix itself, because it has the power to fix itself if we would just get out of the way. But because of what we do to our bodies, we cause a lot of toxic issues, and we cause a lot of roadblocks. So I'm giving you a lot of different modalities, technologies, resources in which you can change the environment that your body is trying to heal, and you'll heal faster, more efficiently, which means you get back to doing what you absolutely love. And then T is treatment. And treatment is just the different things. Treatment is red light therapy. Treatment is a TENS unit. Treatment is cupping. I do a lot of cupping. Cupping is awesome. I have actually invented my own cupping brand. And Lifepro has got power activated cups. I don't know if we have them in stock, but I use them as well in my practice. But cupping is incredibly powerful for pain relief and for scar tissue and for mobilization on the other side of surgery. So cupping is awesome. Form of treatment. There's so many different forms of treatment. Massage is considered a treatment. There's a lot of different things you can do, but work with your medical team wherever you may be. And if you have questions that we can help you with, don't hesitate to reach out to us. If you have been able to take advantage of our Amazon Prime days here in this last week, definitely encourage you to continue to look at that pricing, because we are now coming out with rock bottom prices because tis the season. Our Black Friday is coming up, the holidays are coming up, and we are coming out with more and more new products, new technology. And of course, being part of Lifepro means that we are way ahead of the curve of other brands and product companies, as well as your therapists' products available. A lot of therapists don't even know that this stuff exists because they're in the protocol. They're staying in the protocol. So don't hesitate to ask some questions to your doctors or provide them this video. And, if they debunk us, then let's talk about it, because I don't like to debate. I don't like to argue. I don't like to put other professionals down, but I do like to learn, and I do like to express the clinical findings that I have, as well as my expertise from me actually doing the work with these people and seeing what happens on the other side. When you do it over and over and over and over again, and you can expect to see the same results for a lot of different benefits, that's a win. But not everybody gets to experience that. So that's what we're all here for, is just to help each other out. So let us know how we can help. So thank you all so much for watching, and I will look forward to seeing you all again in our next episode.